Dr. Jason Dapore. He's sports medicine physician at OhioHealth, McConnell Spine, Sport, and Joint Center. And, Doctor, I know you also work with Upper Arlington schools and the Blue Jackets too, right?
Yes. Good morning, Joel. How are you?
Doing good. I appreciate your time. We got this story. Well, really, it was more of a comment from the president saying that if he had a son, might not let him play football. And I guess to start, is football the most dangerous sport for our young men to play?
Football does have and speaking about concussions, football does have the highest incidence of concussions per athletes playing. And
is it true in all kinds of injuries, or is it just specific to concussion?
Really, it's definitely for concussions, and then as far as upper body, lower leg injuries, it is among the highest. It's probably one of the more violent contact sports, but in the context of concussions, you also have to consider lacrosse, women's soccer. There are other sports that have a pretty high risk that often go unrecognized because football tends to get all the big headlines.
Yeah, and that's what intrigued me about his comment was because when you look at, like you say, lacrosse or soccer, those kinds of things, they don't have as much protective gear as football. And I was thinking that maybe, especially early on, like the biddy leagues, the Colt leagues, that maybe those kids were actually a little better protected than the ones that start in the young soccer leagues. Do you think is that fair or no?
Well, I think at all levels, as your child enters a sport that has a high risk, it's really important for the parents and coaches to be extremely vigilant and take time to educate their young athlete on the signs and symptoms of a concussion, that these injuries can occur, and it's very important that they make the young athlete feel very confident and comfortable reporting when something doesn't feel quite right.
Yeah, and then that's the thing specific to concussion. I mean, if you have a broken leg or an owie on your arm or whatever, it's pretty easy to point out and go, that's a problem. But concussions, sometimes, kids totally blank out. Other times they just have a little bit of a headache, and then a couple of days later they're back to what you think is good. Not necessarily true because a concussion can still be there.
Yeah, the symptoms can range from very subtle to very profound, and that's just why it's very important, for the athlete just to feel confident in reporting, any sort of subtle symptom, especially after a big hit, or even after a couple small hits. If they went through a heading drill in practice, or if they had a couple small hits and they still feel a little headachy or a little off, just to feel comfortable reporting those symptoms.
Yeah, I know in the last year you were in front of the Ohio Senate talking about these very things. Do you get a sense that because the national conversation is kind of about NFL and concussions, that we are getting better, that coaches and parents and even the young people themselves are better at identifying and saying, hey, maybe I need to stand down?
Yeah, there's no doubt about it. We've seen much less resistance in the sports medicine and sports communities. That when we sit an athlete out, the coaches and administration, and even the athlete, that they're more accepting of the downtime with regards to concussion, and that speaks to your point about the higher profile of football. Yeah. They're seeing athletes' careers being ended and cut short early because of the effects of cumulative concussion injury.
Yeah, and it seems too with the Super Bowl this weekend. When you watch the game, especially in the professional level, it's almost like from player to player, there's like different helmets. Has the technology gotten better? Are we protecting our athletes better through technology in sports gear?
Somewhat. Really, I think there will never be a concussion-proof helmet. The biggest change, I think, will be reforming practice techniques, penalizing players for vicious or violent hits to the head. I think that's where you'll see the biggest change. But again, as our athletes continue to get bigger, faster, stronger, the hits are just getting more and more powerful.
Yeah, and because you've been in the business a while, are you seeing different kinds of injuries now versus maybe 10 or 15 years ago, or is it still pretty much these are the things that we see year in and year out?
Right now, there's been some major rule changes, many years ago that limited some of the cervical spine injuries. So we're kind of at a point now where we're very sensitive, with working with statisticians and injury data to notice that if there's an uptick in a particular type of injury, the sports, especially at the professional level, they're pretty quick to see what happened. Was there a rule change? Was there an unintended consequence from a field surface? So, working closely with the epidemiologists, we're keeping closer eye on our injury data for sure.
Very good. That's great information. I appreciate your time this morning. Oh, hey, I know one question. Do you have kids?
Yes.
Would you let them play football?
I have a son who's getting ready to turn 5 years old.
Okay.
If he has a strong passion to play football and he is going to be genetically gifted to be a very good football star, I think I'll let him play. But so far, the genes are not in his favor.
I understand. Hey, that's something that moms and dads talk about all the time. Doctor, I appreciate your candor very much.